Hi everyone, my name is Kylie James. I am a certified nutritionist here at Kuru Nutrition. We just started running this interview and then I realized we weren't Facebook Live. So I always struggle with doing Zooms and Facebook Live. So we're live now so we can, we can get back to the interview. So I'm really excited today to chat with Bronwyn, who is our naturopath doctor at Kuru Nutrition. She has been with us. How long have you been with us now for Bronwyn? Is it almost a year?
2018.
A couple of years. Oh my gosh, time flies.
Yeah.
I want to firstly congratulate you because you just had a baby boy. How old is he now?
He's 2 months. Yeah, thank you so much.
So brand spanking new. That's awesome. Congratulations. So each month we do a theme at Kuru Nutrition on a specific topic, and this month we're doing it on pregnancy and healthy pregnancy. So I thought perfect to have you on, Bronwyn, to sort of discuss that. But first of all, I guess a big question that people probably want to know is, what is naturopathic medicine? Like, what is it and what do you do?
Yeah. So as a naturopathic doctor, I'm trained to really address somebody's health from, the bottom, the foundations of health. And so this allows us to optimize and address one's health by really impacting their overall life. Right. So what I love the most about naturopathic medicine is that we can not only treat concerns, but we can also optimize health. And in my opinion, it's true health care, right? So this is addressing things through a dietary approach, supplemental approach, or clinical nutrition, using exercise as medicine, and looking at mental health and the body as one, holistic approach to medicine. So really addressing somebody's health from that ground point where we can understand why something is truly happening, so that we're not merely just treating symptoms, we're really getting to the bottom of it. And one of the things we can do as well is use specialized testing or just your typical blood work to really understand why something's occurring, so that we can have root cause centered medicine and help somebody attain true health.
Yeah, I think you hit the nail on the head there, like root cause, because sometimes in the medical world they address the symptoms, but maybe not necessarily that root cause. So I think that's
So important to feeling truly healthy.
Yeah, for sure. So why did you decide to be a naturopath doctor?
Yeah, I think that something that impacted me at a young age was that my grandparents actually owned a health food store. And so I would spend my summers, helping out there, kind of working there, but also, grabbing bottles off the shelf and reading them and learning why we would use, a targeted supplement to improve somebody's health. And in my head, I was always going to medical school. And so I was sort of, disaligned there when I realized what true healthcare could be, and also what was lacking in our medical system. And so when I found out that naturopathic medicine existed, for me, it was like all my stars aligned, and I realized how I could have a true impact on somebody's health. Now, I'm not saying that to discredit our medical system at all, because it's so important to have there. But I believe that through naturopathic medicine, I could learn the tools to really impact somebody, again, from the ground up, and have that healthy, positive impact on their overall life.
Yeah, awesome. And then do you have a certain specialty that you sort of deal with? Because there's so many branches you can go off to, right?
Yeah. So I mainly work with women trying to conceive, so those in their reproductive years, trying to have a healthy pregnancy or struggling to conceive, so ones that need further assistance. And then I also do a lot of work in, the brain health, cognitive health, and neurological disorders as well.
Awesome. And what about mental health? Because that's a bit of an epidemic right now too, eh?
For sure. I think mental health has a role to play in every single concern, and it can never be ignored. So I think it's important to focus on that no matter what somebody comes into the office with. Mental health is something we're always addressing.
Yeah, yeah. Now, what do you recommend someone that is, say, wanting to get pregnant, wants to have a healthy pregnancy? What are some of the things that you look at and address for a woman coming into your clinic with those concerns?
Yeah. So if it's, a healthy woman, healthy man trying to conceive for the first time, this is where it's still fun, right? I want them to try to focus on preconception care, so that care that we give before someone wants to conceive, for about 3 to 6 months. And this is where we can really impact things like egg quality and that blueprint that's going to be set as soon as egg and sperm meet. So this is where we can do work through diet, again, supplementation, exercise, modifying lifestyle, to support a healthy pregnancy and also easy conception. So, if there's no underlying problems, I work with my patients to optimize and go have fun for a couple months. And then if things aren't happening after about 3 to 6 months, that's where we dive in a little bit deeper. So if you're just looking to support a healthy pregnancy, this is where you really want to incorporate a good prenatal that has 1 milligram of MTHF or methylated folic acid. So that's probably one of the most important things you can do. This supports egg quality, but it also is going to be there to support the baby's development in those early days. And then also,
well, I was just curious, like egg quality, like what strategies would you recommend to support egg quality?
yeah, so I mean, it depends again on what is there in that person's life that may be impacting their egg quality. So naturopathic medicine is very individualized, and that's why, when I meet with someone, I talk to them for an hour and a half to really pull out all the good information so that I can put together a really holistic treatment plan. But we know that things like oxidative stress impact egg quality. Age is a big one. So that's one that we can't change, but it helps us understand how we're going to treat if we have to be more aggressive or not. So antioxidant support is what's the strongest, I think, in terms of supporting egg quality and improving or enhancing egg quality. So these are things like CoQ10, melatonin, all the antioxidants like A, C, E, selenium, zinc. So these are things that we can use to actually see an improvement in egg quality in individuals, whether you're trying to conceive naturally or if you are going forward with something like IVF or other fertility treatments. So we always want to be addressing the quality of those eggs, but lifestyle factors come into play too, right? So no smoking, limiting alcohol, caffeine, like these are things that I talk about with all of my patients to make sure we're not, throwing fuel on the fire while we're using supplements, because that's not going to, give us any kind of net positive outcome.
Yeah. So what about and I feel like this is becoming more and more of an issue, like infertility and people struggling to get pregnant. I have so many friends that have really struggled with this. So when someone is wanting like to get pregnant and struggling, what are some of the things that you do, like tests that you do and recommendations?
Yeah, so this is where we really do want to dive in with some testing. So understanding hormones, right? So on day 3, this is really important. The timing of testing, where we look at your estrogen, your LH and FSH, so those hormones that come from the brain to the ovaries, day 21 progesterone. So we want to make sure that you're actually, in fact, ovulating if you want to conceive. And this is something that's often overlooked. So it sounds so simple, but a lot of these tests aren't done in people until they reach that 1 year mark of trying to conceive, when they get that kind of diagnosis of infertility. But there's other tests we can do too, right? Like nutrient levels, your vitamin D, B12, iron. We know these are going to have an impact on your ability to conceive and also your ability to maintain a healthy pregnancy. And then other things like anti-Müllerian hormone, or AMH. This is what tells us about ovarian reserve, or how many eggs are kind of left in the ovaries. Now that's kind of a simplification of it, but it gives us a number that allows us to know what we're working with. Is there hardly anything left in those ovaries, or do you have a ton, or does it tell us you might have a condition like PCOS? So there's a number of tests that we can do depending on the person, but baseline nutrient status and hormones are definitely a good place to start to get some basic understanding of what's happening beneath the surface.
So if you had like someone, what would be 3 like recommendations that you would recommend to someone that was maybe struggling to get pregnant?
So if you're struggling based on your age, that's a little bit different than struggling in like maybe early 30s, I would say. So I would say that those two kind of do have to be separated, because it is
Okay.
a different.
Oh, that's interesting. Yeah, because I was 42 when I had my son, so I was in that sort of.
Yeah, and that's what I mean. I love stories like that, right? Because people conceive into their 40s. Like we can, if we have a good foundation of health, you can conceive later for sure. But overall, I'd say women are waiting longer, right, to conceive. And I think that's the biggest reason why we're seeing that increase in infertility, because we know that eggs egg quality does decrease with eggs, or with age, sorry. Egg quality decreases with time.
When is that age cutoff where it starts to decrease?
So 35 is kind of that age where we say, okay, from this point on, we're going to hit your eggs hard with egg quality support, just in case we are actually dealing with poor egg quality. But everyone's going to be different, right? There's healthy 42-year-olds and really unhealthy 22-year-olds that might be struggling too.
Right. Yeah. Awesome.
What was the actual question there? Sorry.
3 recommendations for someone that's sort of struggling. So I guess it's hard because it depends if they're older or they're younger, right? So
it's definitely challenging, but I'd say overall, like, we always go back to the basics, right? Like, what are you eating? What are you fueling your cells with? Are you getting good protein and good fat? Because these things are important for hormonal production and secretion, right? Fats are made from cholesterol. If you cut fat out of your diet, we're worried about your hormone production. And then micronutrients through, good fruits and vegetables, blood sugar balance. Like, diet is huge when it comes to trying to conceive, and then also trying to optimize egg quality if you're a little bit older as well. Sleep and stress. These two are huge. If you're going to be, functioning under really high stress, we're going to assume that your reproduction is being put on the back burner. So when we're stressed, the first thing to go is your brain tells your ovaries that it's not a good time to reproduce. So we need to manage stress. And sleep is another important thing to manage stress, but then also to support normal hormone secretion and production again. So that estrogen and the progesterone. So, looking at those lifestyle factors is definitely like a first step thing.
And it's so tough right now with a pandemic and lockdown. It's like, it's a hard time probably to conceive, even more so because of all the stress, especially if you've got little ones at home already.
Yeah, I really feel for anybody trying to conceive right now, because they've got, already a stressful, we'll say, condition that they're dealing with the pandemic on top of that. And anybody at a fertility clinic right now too, it's just, everything seems a little bit more challenging, which adds to that baseline stress.
Yeah, for sure. And is Bubs asleep right now? Did he just finally go to sleep?
He is asleep.
Oh, I'm glad I got a peek just before we went live. But Bronwyn, thank you so much for coming on and sharing these ideas. And if anyone wants to reach out to Bronwyn, they can through Kuru Nutrition, and we do have an online booking site on our website too. But thanks, Bronwyn, so much for coming on, and everyone out there, please stay safe, and we'll see you soon. Bye.